Welcome to Health Facts with Dr. Danesh. In this video, we're going to find out if we should be concerned about sending our kids to the school this September. And we're going to find out what is the best approach moving forward with COVID-19 pandemic. And we're going to take a look at the statistics about flu in the recent years compared to COVID-19 infection. But first, some news. Total number of coronavirus cases are 22,860,184 patients, and death toll is 797,105 patients. Recovered are more than 50 million people. In the United States, we have close to 6 million coronavirus cases, and death toll is 177,424 deaths, and recovered are more than 3 million people. This chart, which is from Johns Hopkins University of Medicine, shows that the case fatality of COVID-19 disease, which is the number of deaths in 100 COVID-19 patients, is the highest in Mexico, which is 10.9%, Spain with 7.8%, and Iran with 5.7%, and Peru with 4.9% are the respective countries after Mexico. This colorful chart is based on provisional death counts for coronavirus disease in United States from CDC, Center for Disease Control. As you can see, age 0 to 24 with blue code blue color has the least number of deaths here, and the 85 years and over with burgundy color has the highest number. Reporting period for this chart is week ending the February 2020 through August 8, 2020. There are more interesting charts in CDC website. One of them is death by sex, ages 0 to 18, and involving COVID-19 disease. And the other is death by race and Hispanic origin, ages 0 to 18. If you click on each one of these charts, you could see the expanded form of the chart. During the past 6 months, age group 0 to 4 years old, we had 16 deaths, which is male death, and we had 10 female deaths. Age group 5 to 18, we had 32 male deaths and 23 female deaths. In non-Hispanic white age group 5 to 18, we had only 11 deaths, and age group 0 to 4, we had 7 deaths. In non-Hispanic black race, we had 16 deaths in age group 5 to 18 and 4 deaths 0 to 4 years old. In Hispanic or Latino people, we had the highest number of deaths in age group 5 to 18 years old, which is 23, and age group 0 to 4 years old, 12 deaths. Now, if we take the comorbidity in account, which means patients with the underlying disease, only in 6% of the death related to COVID-19, COVID-19 was the only cause mentioned. For death with conditions or causes in addition to COVID-19, on average, there were 2.6 additional conditions or causes per death. Other forms of influenza virus and pneumonia are one of the underlying conditions. Another underlying disease would be chronic lower respiratory diseases, and so on and so forth. Now, if we take a look at the estimated influenza disease burden by season in the United States from 2010-2011 through 2017 and 18 influenza seasons, highest number of illnesses are from 2017-2018, which is 45 million people. In this chart that you see lots of pyramids, and it's actually divided to 3 colors. The gray color is illnesses, the burgundy color or brown color is hospitalizations, and the yellow is death. So the number of deaths in pyramid 2017-2018 is 61,000 people, and the hospitalized people is 810,000 only in that season. Here's a bigger view of this pyramid related to 2017-2018 flu season to see clearly what portion is related to the death, 12,000 to 61,000 as mentioned. Hospitalization is 140,000 to 810,000 people, and illnesses 9,300,000 to 45 million people only in flu season. But what is the percentage of death toll in age group 0 to 18 years old? Well, in CDC website under influenza or flu, we have the whole separate part for children and influenza or flu, where it says even though the reported number of death during the 2017-2018 flu season, which we talked about, was 187, CDC's mathematical models that account for the underreporting of flu-related death in children estimate the actual number was closer to 600. When is the flu season in the United States? Peak month of flu activity since 1982 to 1983 through 2017 and 2018 was always October to March, which is 6 months. As of August 19, 2020, the total number of deaths in children between 0 to 18 years old are the sum of these two numbers, 29 and 63. And that would be 92 deaths. Now, 92 deaths is not a small number, but compared to 600 deaths from the flu in 2017-2018 that we just discussed is almost 1/6 of that number. Now, if you remember, we mentioned only 6% of the whole number of deaths in age group 0 to 18 from COVID-19 is the actual number that they only have COVID-19 disease. It's only 6 children out of 92 deaths that we had from COVID-19. That means 86 children out of the 92 deaths related to COVID-19 had some sort of underlying disease, which we already mentioned, such as flu and lower respiratory pneumonia. So almost only 6 deaths purely related to COVID-19 in age groups 0 to 18, which is a very small number compared to flu death in 2017 and 2018 flu season. So if we keep doing whatever we're doing in terms of social distancing and wearing the mask and washing the hands properly, sending our kids to the school is not a major risk after all. As long as they're not in contact with patients with chronic conditions at home, such as diabetes, hypertension, hypercholesterolemia, and in contact with the elderly people at home again, and also patients who are immunocompromised. I hope you enjoyed this video, and if you like this video and find it beneficial, please share it in your social media and to your friend and families. And like always, stay happy and healthy. Thanks and have a great day.